Hi there, Dr. Tansavatdi here. So this video is going to be a instruction on what you're going to need to do after your lip augmentation and or your lip lift procedure. Sometimes I do both of these procedures together. Your procedure may just be the lip augmentation or it may be the lip lift procedure. Either way, I'm going to highlight the instructions for both procedures. So the first thing you want to know about is that the day of your surgery, you may not be that swollen, and that's okay. Initially, you will also be numb, and you won't be able to feel anything. You're like, oh, this is not too bad. There's not a lot of pain. There's not a lot of swelling. It will settle in. So by the time you reach home, and a few hours after, you may start to feel the pain. So catch the pain earlier rather than later. So stay on top of it by getting on the Tylenol that we've prescribed. So Tylenol should be taken every 6 hours and scheduled. So we don't want you taking this if you need it. We want you to just go ahead and schedule it every 6 hours while you're awake. The other thing that you're going to be using is Celebrex. Celebrex is something that we've prescribed for you, or ibuprofen, but I prefer Celebrex. And Celebrex is going to be taken the morning of the procedure. You're going to take it on 1 hour prior to arriving, and then after the surgery, you're going to resume again in the evening. So that will be twice a day, so morning and evening, following that for an additional week until you're done with that week. So that will help with the pain. The other thing that we will have prescribed for you is tramadol for pain. Tramadol is not a narcotic per se, but it is similar in that it works very similarly to narcotics. It can make you sleepy, it can make you drowsy, it's less likely to make you nauseous, but it is a pain medication. So that is something that you may want to take in the evenings, not during the day, because it can make you a little more groggy. Okay, so that's with the tramadol. In terms of the day of the procedure, when you leave here, your lips will feel numb. We don't want you to start drinking anything or eating anything right away because you won't be able to control your lips and you could aspirate or get fluids down your throat that you're not wanting to do. So if things are numb, we want you to hold off, and as the sensation starts to return, you will feel some pain, and that's when to take the pain medications. But one other thing that you will want to do is as you get home and before the sensation starts to come back, you are going to use a cold washcloth that has been dipped in ice water, and you can put that over your lips. The other thing that can be helpful is to get a bag of peas that's been in the freezer, and you take that out. And that's very nice and soft. You could also use an ice pack, the soft gel packs, but make sure that they are not rock hard, solid, and icy, because your lips may not be able to, you might not be able to feel the temperature initially, and you could cause a burn, a cold burn, per se, a freezer burn of the surface of your lips, and we don't want that happening. So to be safe, use ice cold water, dip a washcloth in that, or you can take a washcloth, dip in water, put it in the freezer, and take it out every so often to pull out and use for your lips. That's the safest way so that you're not getting too cold of a temperature right on your lips. You're going to be doing this every 20 minutes. It says 20 minutes every hour. I do think that the more you can do it, the better. So the minimum is 20 minutes every hour. If you can do 15 minutes on, 15 minutes off, 15 minutes on, 15 minutes off, while awake, that's the most helpful. When you go to bed at night, you stop though. We don't want you doing this through the night because sleep is important to healing. So we want you to get as much sleep as possible, particularly that first night where it's kind of difficult. So take the tramadol for pain before you go to bed and then get a good night's sleep. If you've had a lip lift, you're going to want to clean the incisions. So right under the nostril, there'll be these incisions there. You're going to clean that with a half-strength hydrogen peroxide. Don't overdo it because the incision may not heal appropriately. But we just want to remove any blood, dry blood on the incision itself so it can heal appropriately. So you're going to do that, and you're going to apply, after you've done the hydrogen peroxide, you're going to dry it with a dry Q-tip and then apply an antibiotic ointment. We recommend bacitracin or Neosporin for that area. The other thing that you will be using is for those upper lip incisions right under the nose, we're going to get you a spray. It's called Antisept, and that is a hypochlorite solution, a dilute one, and that also helps to decrease infection around this area. There is a high chance, because of the proximity to the nose, that there are bacteria in that area that we can't completely remove when we clean the skin prior to surgery. So that is one thing that you'll also use after surgery to spray the area so that it's nice and clean. All right, next thing here is if we used a graft for augmenting the lips, so typically use that from behind the ear, or if you had a facelift procedure and we took it from the snaz, there'll be incisions here. So for those purposes, you're going to be also cleaning the incisions behind the ear and around the ear with hydrogen peroxide as well, and then drying with the Q-tip and putting antibiotic ointment there as well. If we did get the graft from behind the ear or in front of the ear, you will have a dressing that needs to be removed the next day. That's a dressing to hold pressure in those areas. So you will have a follow-up appointment the next day to take down that compression dressing. So the first night you won't need to do the hydrogen peroxide to clean the incisions because it will be covered, so you won't need to do that. But following the removal of the compression dressing, then you're going to start doing that. And again, you're going to want to do this 3 times a day. For the area, for the incisions behind the ear, you will feel some numbness in that area, so sometimes it's hard for you to really feel where you're putting it. You might need somebody to help you, or what you do is you really just drag the Q-tip right along where you feel the back of your ear and just drag it along the back there. Make sure to use Aquaphor or lip balm on the lips because they will dry out, particularly on day 1. I mean, not day 1, but the following day after surgery. The lips will start to really swell, and they will reach a peak around day 2 or day 3. So you'll want to start putting Aquaphor ointment or chapstick or lip balm to really keep the lips moist. The other thing that's helpful is to go get a sippy cup. These are the little sippy cups that toddlers use. It's very helpful because you won't be using a straw. You can't. It will be very hard to get a seal because the lips are so swollen. It's hard to kind of grip around the straw itself. So you want to use a sippy cup, and that's going to be helpful. And the other thing that you want to use is a soft toothbrush. So you want to avoid using your regular big toothbrush. You want to use a soft, small, like a baby toothbrush to brush your teeth. And if it's too hard to open your mouth, I would avoid even using the toothbrush. Don't use mouthwash over the counter that you get. Most of the mouthwashes that are available are alcohol-based, and that can have a detrimental effect on the incision if we've done a lip augmentation. Because there will be an incision just on the inside the corner of the mouth for the augmentation. That's where the graft was inserted, and so the incision, you want to keep it from getting irritated, so don't use mouthwash at this point in time. You will have dissolvable, so these sutures on the inside the corner of the mouth are dissolvable, and so you want to leave them in place. Don't pull at them, don't remove them on your own. So about the soft toothbrush, you want to use that for the first 2 weeks so that you're minimizing the movement of your lips when you're brushing your teeth. Swelling is normal at this time, and it can get worse on day 2, day 3. So again, be mindful of the fact that it could get worse. You will want to sleep with your head elevated because that will help with the swelling. So sleep at a 30-degree angle. So that's most likely if you have a bed and you don't have a recliner, putting pillows propped up to where your back is higher, or so your head is higher than your heart. So in that angle where your head is higher than your heart. If you do feel like the lips are extraordinarily huge and tender and there is something what we call hematoma that can occur with the lips. So if there is concern that this might be a hematoma, you'll want to give us a call. So any excessive swelling with pain and other symptoms, you'll call us at 805-715-4996, or you'll reach out to us through the Simplast app and message through the app for patient care or surgical care, and we should be able to get back to you as soon as we can. Your diet, this is going to be most helpful. Pick up these foods before your surgery so you're prepared, but you'll want to get a lot of soft foods to eat, and particularly the first few days, maybe even liquids. So what you're going to deal with is you could get protein shakes to help you. You'll want to get try to get smoothies. You can take lots of greens and blend them if you're into healthy living and getting greens to do that. You could do that as well to make your smoothies. You'll want to use cold liquids or lukewarm foods. So if you have, let's say, mashed potatoes, make sure it cools down before you put it, before you eat it, because you may not be able to feel it when you when you are eating it. So avoid scalding hot liquids. You'll want to transition to soft foods after the first few days, because the first few days you may want to just stick to liquids because you'll figure out that it's hard to move lips. But after that, you'll slowly transition to soft foods. And some ideas for soft foods, we're going to be providing you a list, so please look at that list. That's very helpful. Those are foods that are good in sources of fats and proteins, which are helpful during the recovery process. So we don't want you using, like, let's say applesauce, even though that is a good, nice soft food that you could have, but applesauce has lots of sugar. And so we're avoiding anything with lots of carbohydrates and simple sugars during this recovery period because it will have an effect on your healing. That will create more inflammation, which your body is already dealing with inflammation trying to heal. So again, avoid sugary foods and stick to more protein and fats for the calories. Talking should be minimized. You want to avoid laughing, of course, smiling, and talking with your lips, because movement here is going to stretch this incision from the lip lift incision, as well as stretching around the corners from the lip augmentation. All right. So the rest of this is going to be general surgery, post-operative instructions, and this is going to apply to any type of surgery. But what we want to highlight is that you're going to take your extra strength Tylenol that we would have prescribed and told you to take, which is 500 milligram pill. You're going to take that every 6 hours, at least one pill. If you have more pain despite this and you don't want to take the tramadol quite yet, you can double up and go up to 2 pills every 6 hours. That is staying within the the maximum, and you were not going to be injuring your liver. I know there's concerns about that, but for the short period of time after your surgery, this is going to help with pain control and going to be beneficial for you. To avoid an upset stomach, take your medications with food. So there's arnica and bromelain that we would have given you, and that's for bruising and swelling. You should have started that 3 days before your surgery. After surgery, you're going to start resuming that again. The bromelain needs to be taken on an empty stomach. The arnica is dissolved under your tongue. With both of these, the arnica you could take with food. With bromelain, this needs to be taken on an empty stomach, so with no food. You're going to take your antibiotic as prescribed and finish it. So it's about a 5-day course, so complete that whole course. You're going to continue taking the Celebrex as I discussed earlier. You're also going to want to avoid sleeping with somebody else who could potentially bump you in the face. So we don't want any injury to the area that was just done. You're going to also, if the first night you had some sedation and you're concerned about how you're feeling in terms of awareness, you may want somebody in the room with you. Swelling, we said earlier, is normal, starting on the 2nd or 3rd day to be the worst of your whole period. Bruising and discoloration is also normal, and that will go away within 1 to 2 weeks. There will sometimes be crusting along the sutures. That's crusting along these sutures right under the nose, as well as in the corner of the lips. Use chapstick for the corners. Use ointment for the area under the nose. So, but we don't want you picking at the sutures or picking at the crust. Let us do that. You may experience some shooting pain or itching during the healing process, that's normal. As the nerves start to wake up from the procedure, you could start to have that shooting pain or itchiness. You can experience some weakness or dizziness. That's common after the surgery. Please drink lots of water because the hydration is going to help you with the healing process. And the reason why you could be weak or dizzy is because you're not getting enough water. You will experience some mild depression after surgery. This is true with any cosmetic surgery, and that's because you start to wonder, did I make the right decision in pursuing surgery? If you see yourself in the mirror, please try to cover the mirrors because that will start to also have a play on your psyche as well. But this is all normal and it will go away. After the stitches have been removed at 1 week, the incisions themselves may look pink, and that pinkness can stay for a few weeks to a few months. You have to be patient, let it heal in its normal process. Some people heal with a pink for a longer period of time. Some people can heal with a dark color in the incision if you have darker skin. And some people can heal with no pinkness at all and just looks light. So those are all different processes of healing after your surgery. Don't drink any alcohol after surgery if you're taking any of the tramadol. You don't want to combine the two medications, the alcohol with the medication. And then avoid bending or lifting heavy objects. You don't want to risk increasing your blood pressure and causing a pull or opening of the incision or even blood, bleeding, and a hematoma under the area that we've just done. So avoid straining. If you do have firm stools where you're having trouble going to the bathroom, then with the constipation, you want to go get a laxative to help you go easier so that you're not straining. And then avoid sunning your face for the following up to 1 month after surgery, and even I would say for some of my patients up to a whole year, because the scars are still maturing for up to a year, and you don't want to get too much sun on these scars. Avoid sexual intercourse for 2 weeks. I know I just said that. Avoid sex for 2 weeks because that's exercise. And then no contact sports for 2 months. You don't want anything directly hitting the face. Tennis, golf, basketball, all these sort of sports that potentially could injure the area are ones that you want to avoid. No strenuous activity for 2 weeks. No swimming for 4 weeks. If you are a swimmer, that is because the incisions can get weak. If you're in the pool, the area gets wet and it can cause the incision to open up. Don't drive while you're taking any of the pain medication. That's a given. And then don't try to remove the sutures yourself. Returning to work all depends on your own stamina and how you heal. So take it easy. Some people want to jump right back into working out at 2 weeks. Take it slow. As you're resuming, you've been off for 2 weeks, so as you start, slowly ramp back up. And avoid, the things that we want you to report to us is that if there's any excessive bleeding or bruising that's out of the normal, it looks like it's abnormal, please call us. If there's bleeding that persists, you want to put pressure on the area first to hold down. And then if it persists after 20 minutes after you're applying pressure, you'll call us. Report any excessive pain. So if there's a lot of pain, it's not controlled by the pain medication, that's abnormal, so call us about that. If you do experience any signs of an infection, that would be redness, that would be weeping from the incision that looks like pus, white material, it's swollen, it's red, it's tender. Those are the signs of an infection, so call us if there are any concerns there. And then if you do have a fever above 100.3, you want to call us about that as well. Could be an impending sign of an infection. If you have a drug reaction like hives or itchiness or a rash, those are potentially a reaction to a medication we've given you, so you want to let us know about that. And then if there's a lump that becomes larger after surgery, you'll want to report that too as well. All right, those are the instructions for your surgery. If you have any questions, feel free to write those down so we can review them at your pre-operative appointment. Thank you for listening.